Good morning, humanity. It's September 16th, 2019, and this is Mondays with Bev and Paul. And hi, my name's Paul.
Good morning. This is Bev.
And
Hi.
hi, Bev.
Good morning, Paul. How are
I
you?
am good. We got that figured out.
We do. Yeah.
So, hi, everybody. We are glad to be with you again, aren't we? Are
We
we?
are.
We
Yeah.
are. You can talk. You can talk.
Yep.
All right, we're going to have a good show today, as always. It's always a good show because it's always nice to be with you out there in watching the land. And if you have any questions that you want to ask us, just post it on the comment section. And hopefully by next week, we're going to have a whole new design for this show. I'm
Yay.
excited
Yep.
about it. But
Yep.
today we have our question. Can BioTouch be used with operations? What do you think of that question, huh?
Boy.
Yeah, and
Yeah. Well, we've talked about it all the time. BioTouch is good with everything, but you know, the pre-op and the post-op, we've had so many opportunities to use BioTouch in those
right,
areas. And I know all of us that have been working at the center for any length of time. Well, I have had recipients come in saying, "I'm going to be having a procedure in the morning. I want BioTouch,"
right,
because they know
right.
that the it helps the body prepare, for the anxiety and just opens the body up and prepares it in this loving way to whatever needs to happen.
So this whole idea this came up because I'm getting ready to go with Jenny for an operation tomorrow, and
Yeah.
it reminded me. And at the same time, I went to this woman who's a homeopath in town, Dr. Chimes, a wonderful homeopath, and she gave out this little thing on uh, what to do before and after operations. And so I realized, wow, we should talk about that with BioTouch just the same way you
Perfect.
did, and talk about the pre-op, post-op, and an emergency situations.
Yeah.
Because yeah, it's like BioTouch can be used with all these things, and not having to worry about any kind of harm to the person going in for the operation. And I think that's the key issue here, because they give you a whole list of things pre-op. You can't do
Right.
this and you can't do that, and stop taking any supplements, and don't do this and that. But BioTouch is not going to give you any harm. Even with homeopathy, it's you have to figure out the different protocols, and
Yeah.
then you have to go buy them. And for some people that can be confusing. But with BioTouch, like you said, people can't had already come into the center for pre-op, just to help the body get ready, like you said.
That just really empowers our, what we're always saying, just touch, because there is none of that concern, as you were just saying, about what not to do and the little protocols that the doctors give you. Can't drink this, you can't eat this within some, you can't do that. When you have BioTouch, there's none of that. You just touch.
Right.
I mean, we really mean that. Just touch.
Just touch. And I think what's great about having the opportunity to do BioTouch is it's good for both the person who's getting the operation and the person who's totally anxious that their loved one's going in for an operation.
The
It's
one that sits in the waiting room,
right,
right?
right.
Yeah.
And so you're immediately, even before you get to the hospital or to the operating room, are able to do something with your loved one, and you're both being able to calm down and relax, and making a communication at a level that goes beyond all the anxiety and the fear, and it just sort of takes it down a few notches.
You know what I was just thinking, because I've heard, and I know most of all of us have heard about certain doctors and hospitals who are now offering little meditation sessions before surgery, to just because they know that it just helps calm the body down. Can you imagine if the protocol in the hospitals would be a BioTouch session?
Right, right.
I mean, That's meditation.
Yes,
Hello.
it's
And the body.
one of the best meditations I've ever seen because it's not about stopping something. Oh, you got to stop your mind or you got to breathe. I mean,
Right.
if you're anxious, it's very hard to meditate, because your mind's just worried about, oh my God, what's going to happen? Am I going to deal with the anesthesia? What's going to happen afterwards? This whole unknown quality. And then you're in these places that have lights blaring around and they're
Yeah.
cold and they're sterile. And so to sit and
All of
just
the
sort of be
above.
mindful and meditate, so called, is very difficult. But with BioTouch, the meditation is you're just present with who you are. And just by doing those points, I don't have to stop the mind. It sort of automatically happens if I'm just doing the points. And all of that other stuff just sort of dissipates, is a good word. It just sort of dissipates because
It,
I'm
it,
just focusing on doing a few points.
well, and the other thing is when you do this prior to an invasive procedure, you've just been connected with another human being that says with that touch, I care, I'm here, I love you, and everything's okay.
Right. And
You
that's
know?
so
I
vital.
mean,
It doesn't
yeah,
matter. It could be just a simple extraction of a tooth,
exactly.
all the
Exactly.
way to open heart surgery, or like Jenny's going to have an eye operation.
Yeah.
I mean, no matter how much you say it's going to be okay, it's going to be okay, giving your life up to somebody else
Yeah.
is not very
You're
easy for us.
vulnerable.
Yeah, totally vulnerable. That's a
Yeah.
good word. So
Right.
BioTouch helps with the vulnerability. So the
Mm,
pre-op is vital, and that can be done, weeks before, but especially the day of, the morning of, the night before, and then we deal with the post-op stuff, and we
right.
have some examples of that one. The post-op is really important too, and the sooner you can get in there with the patient, the better it's going to be because they just it's sort of a dissociation between the body and the soul or spirit or whatever. This body is now being yanked. It's been given anesthesia. It's under these lights,
Well,
and
you're not present consciously in the body at that point.
yeah, you're gone, and this
Yeah.
body's been yanked and prodded and probed, and now BioTouch. What I've learned is as soon as you can get in there and at least do the greeting, and
Hmm.
if not just A&A, it sort of brings us back together. It brings all of our
Hmm.
pieces back together, body, mind, spirit. It
Right.
just melds it back together, and that can be done. Boy, if you can get into that recovery room, and I've done that. I think it was with my mother. I was able
Yep.
to get into the recovery room, which they
Wow.
usually don't let you in because they're waiting to see when you come out of the anesthesia. But if
Right.
all you can do is get to them in their room as soon as possible, then that really helps.
Yeah. Get the body jump started
Right?
to come back into its wholeness.
Yeah.
Right.
Right.
Yeah.
Right.
Yeah.
And I was able to do that once with a woman who had a operation. They told her she'd be in the hospital for about, I don't know, 4 to 6 weeks. It was a long time. She was
Wow.
out in 6 days because I was able to get there right away. She was still under the anesthesia, grogginess. Was able to work with her right away and worked with her every day. And she was able to, the healing process was half the
Was
time, in
yeah.
that situation more. And then you had a situation once they were out of the hospital, right, with Michelle?
Yeah, Michelle. Well, I'll just say that you went over the day she had the surgery
Right.
and did BioTouch with her, and then a couple days later, I drove out to her house to give her a BioTouch session, and I was expecting her husband to answer the door. She answered the door, and I'm kind of like, what are you doing? Oh, I don't know. She healed so quickly. It was amazing. I'm like, okay,
Right.
this is awesome.
And the nice thing was she was able to incorporate a lot of other healing techniques. I think she did
Right.
Reiki and
Oh,
some
yeah.
some kind of, I don't know if it's homeopathics or oils or things like that. So
Yes.
it's not about exclusivity of BioTouch, but boy, there's something about that BioTouch because you're physically touching the body. I mean, I know I've worked with people
Right.
in comas, like with my mother. We'll talk about that in a minute. But there's a sense that somebody's there when you touch another human being on the body, even when they're in a
Mm.
coma.
Mm-hmm.
Because we're sentient beings, we need touch, and
Right.
touch is so vital to the healing process.
Well,
So,
you know what I'm beginning to really realize about BioTouch is BioTouch opens the body to let all of those other things and practices and therapies, all of the other, it's like BioTouch holds it all, and all of those other things can do their magic in the midst of what BioTouch has opened up for us.
right,
So if we just do the BioTouch, then Reiki and the oils and the mindfulness, anything else that we want to do, BioTouch is like the mother. It's like the womb. It holds all of that, and then everything else just comes together so beautifully, and the healing takes place even quicker.
and that includes the medications they give you afterwards.
Yeah.
Two of the things they worry about after an operation is the nausea and the pain. And so by getting BioTouch in there right away, like
Right.
the homeopathic remedies that was shared yesterday, there was one that you take immediately after because part of the protocol the doctors gave Jenny was nausea, what to
Mm-hmm.
do. And so even by just doing BioTouch before there may be nauseous, you be nauseous, it can't hurt. And
Right.
so, and then as soon as there's a feeling of being a little gurgling or you're feeling like you want to throw up, boom, you just do BioTouch again.
There
And with
you
the
go.
pain relief, to get in there right away before the pain happens, and that's the same thing with all these drugs they want to give you. They say, don't wait till there's pain. Take your Tylenol or your aspirin, whatever you're taking, and don't let it get ahead of you. And so with BioTouch, knowing there's no side effects, those are two great things to do in a post-op situation for the nausea and the pain and the bringing the body back into a calm
Yeah.
state.
Perfect.
Yeah. So another operation situation are emergencies. So somebody's in an auto accident or they broke a bone or on and on and on. To have BioTouch right there on the scene while you're calling 911 is like
That's
awesome. It's
that's magic right there.
yeah,
And the magical part is every single one of us has the ability to help another human being in an emergency.
yes,
We have the tool to do that. It's called BioTouch.
yeah. So I mean, you're talking about heart attacks, strokes, all these things that they're going to rush you to the hospital when you do open heart surgery or you broke a bone, you're in an auto accident, you fell off of a swing set, you're surfing and on and on and on and on.
Yeah, a bee sting if you're
Be,
allergic to bee
yeah,
sting.
all these things and the
Just simple
great,
stuff. Yeah.
yeah. And the greatest situation I had was with my mother, who,
Mm.
they sent her into the hospital. They put a pacemaker in, and it punctured her heart. Now I'm in Hawaii, she's in Denver, and they put her on the operating table, and basically she died on the table. And when they brought her back to life, they said if she lived, she'd be a vegetable. And I rushed to the hospital, and I'm working in ICU. So you can do BioTouch in ICU. You can
Right.
do BioTouch with people in a coma. And I worked with her around all those machines, and they're beeping, and you know, and she's intubated. She was on a lung machine because she couldn't breathe on her own. So BioTouch was really effective in that situation. And what I
Amazing.
really learned was all those other people in the waiting room felt hopeless and an incredible amount of fear.
Right.
And that's where BioTouch can be so important because you get to participate. You're not just sitting there feeling helpless.
Well, we know that that whole journey of a loved one involves all of us, the ones that are, going through it and the ones that are watching and observing and many, many times, as we know, feeling totally helpless. Just watching is it takes a toll on the loved ones, their own stress levels and their
Right.
worry and then you have something like BioTouch. And when you have the family or friends practice biotouch with each other, everybody wins, whether you're the one going through it or the one watching it.
Yeah.
It works on those stress levels, anxiety. It's just love.
Right. And then it's easy also for all those people in the waiting room to work on one another.
Yeah, for sure.
There's nothing worse than waiting. I
Oh
mean,
God.
I've done that a few times and it is terrible. And,
Yeah.
you're waiting for these people to come out and the wait is worse than anything else. So to have
Yeah.
a support group touching each other and we're talking about very simple things here. We're talking about, if nothing else, the greeting. And
Oh, right.
yeah, so let's show that again. We always want to make sure that you're all understanding how to do the greeting. So here we go. Here's our manual, and we're going to just show you how to do the greeting again.
The greeting is always performed at the beginning of each session. It's the only set that uses one hand and the only set that indicates which hand to use. The greeting is performed with the dominant hand. If you are right-handed, use your right hand. If you are left-handed, use your left hand. The greeting is made by touching at point 1, which is in the fleshy area just below the bottom of the breastbone or sternum. Hold this point for 6 to 8 seconds. Then, with the same 2 fingers, touch point 2 on the back. To find point 2, look for the big bone at the base of the neck. From here, move 1 to 1.5 inches to the left. This is point 2. Hold this point for 6 to 8 seconds. More than one associate may work with a recipient provided that all of the associates perform the greeting. If the associate or the recipient leaves the session, or if someone who hasn't done the greeting touches either the recipient or the associate, the greeting...
There you go. That's that little boy working with her mom and working on daddy. And that's
Yeah.
Lay, the woman I worked with in the hospital right after the operation, who got out in less than a week when they told her she'd be in there for weeks. So,
Wow.
yeah, she had a cancerous thing on her liver, and they had to take that out in all kinds of situations. So
Good.
it's just that simple. It is just that
Yeah,
simple.
if that's all you've got is the greeting, all you have time for, that's going to be enough for the body to receive something. It knows what to do with, and it starts.
Right.
Something's gonna happen.
Something's going to happen.
Even with the greeting, just the
Yeah,
greeting.
and I hope we're getting that across. I don't know. We've been doing this for almost 3 years, isn't? Aren't we coming up with an anniversary here?
3 years in September.
This is
Yep.
September.
I know. 3 years. I don't know the exact date, but
We'll
it's
have to
been
find
3
it out. I
years.
think next week we'll call it our anniversary as we have the new
Anniversary.
stage. So,
Okay.
we're here every week to help you learn it. Go to biotouchhealing.com. That's our new website, or justtouch.com, and learn how to do biotouch. You can download the first 10 pages for free, send your friends, send your loved ones there, send the person that you meet at the Safeway. BioTouch Healing, it just takes you right to it, and we happily will share with you how to do BioTouch as we do in our monthly workshops. Here is our next one on elderly care. BioTouch can be so beneficial for this. We got John Abraham as our guest speaker. We're going to teach just a few sets of points on how to work with our elder community because it's getting to be pretty scary for a lot of people. I'm reading a lot of articles about the scary care facilities and situations for our loved ones.
Right.
And John Abraham's going to talk about it. He's worked with healthcare administrators. He's worked with the medical system and the elderly population, also through hospice programs. And he's also going to talk about how to choose an excellent elder care attorney. And then we'll teach just a few sets of points. It doesn't take a lot. You don't have to learn the whole technique in order to be effective with BioTouch.
Well, there's certainly a lot more people, our generation, they're saying that we're having to step in and take care of our parents, and to have something like BioTouch at our disposal that we can do with our parents or loved ones every day is just the most amazing gift.
Yep. So that was a quick 20 minutes, Beverly.
I know, Paul.
So I'm going to turn to you. Thank you, Bev.
Thank you, Paul.
And thank you, everyone, for joining us. We know we got Horace on here now. So, Horace, we're going to play your song that you gave to us called Love into Action. And
Thank
otherwise,
you.
we'll see you all next week.
Have a glorious week, everyone.
If pain has got you down and you live in town, take a trip down to Pima Street. The people down there are people who care. They will get you back on your feet. Put love into action. Put love into action. If you ever want to have